every time you phone 111, so we first spoke to them at 10:30 in the morning. Every other time we spoke to them, their priority system says that they have to help you and resolve your problem within 2 hours, possibly 4 hours if they're very overstretched. That was the time limit they put on Charlie's need. Every time you phone, that clock starts to run afresh. So the original time frame should have been a maximum of between 12:30 and 2:30. But because we phoned back and our last call to them was at 1 o'clock, the time frame actually ended between 5 and 6, because the original time frames have disappeared off the system. So that's part of the problem. The other problem is about the time frame that they give you in the first place. And this is, I think, the most dangerous aspect of what 111 do and how they work. Their call handlers are called health advisors, and they're not medically trained in any way, shape, or form. They don't even know how to spell epilepsy, in our experience. They are under instructions to follow a set of questions that appear on a screen, and those questions vary according to which answer, yes or no, you give as you go through the program. That's what's called the algorithm. Their algorithm instructs the call handler to assess the health condition of the caller at the time they're making the call. And the problem with this, which anybody who knows anything about epilepsy will know, is that when you call to say, I might have a really bad seizure because I haven't got my medication, at that point, you're going to be completely compos mentis. You're going to seem normal. But at any second, you could have a massive seizure. And there is no account taken of that possibility in the entire 111 triage system. Nothing. So I've coined a phrase, if you like, which is cliff edge conditions. I personally have diabetes and asthma, and I know that both of those conditions can be suddenly triggered, and I can be fine 1 minute and not the next if I don't have my medication, which is also obviously true for people with some heart conditions, people with epilepsy. Apparently Parkinson's is another one where if you don't keep up your meds, you can suddenly get very seriously ill. The idiocy of this system is proven by what 111 call safety advice. So at the end of every call that anybody makes to 111, they will be told by 111 to call 111 back if their condition deteriorates or changes. Again, as anybody with any of the conditions I've just listed will tell you, if you collapse with a heart attack or in the midst of a seizure, you can't possibly call anybody back. Can't even call for help, let alone calling 111 back to beg for medication. So this system just does not work. And the level of priority they gave Charlie was level 4 out of 7, 1 being the highest priority and you've got to help in half an hour, and 7 being 24 hours. So he was given a priority of 4 to 6. So when 111 then sent the referral back to overstretched London 111 for a GP call, they told 111 in London that he needed a call from the GP in 4 to 6 hours. At 1 o'clock, when he'd been trying to get meds off them since 10:30 in the morning. And the distressing thing about this is that, if I had another child with epilepsy who, for whatever reason, ran out of meds, and we called 111, that person could be left to die without their medication, just like my son was. Nothing's changed in 3.5 years. And I've done quite a detailed piece of research looking at the number of people who've died as a result of poor service and inappropriate triaging by 111. And I found over 100 cases. That's 100 young people who've died in the last 5 or 6 years. It's appalling. And that system is still how it operates. So I guess the end of Charlie's story in a nutshell was that nobody called him back. The GP service didn't call him back. We managed to track down a couple of tablets which he'd left at his girlfriend's flat. They were 6 milligrams, so 25% reduction, and they were out of date because he'd been off 6 milligrams for 2 years by then. But we got hold of those. He wanted to go home. He wanted to isolate. He didn't want to be out and about. And I think because he hadn't had a seizure at home for so long and had been basically so well, we made the literally fatal error of taking him home with that medication. And I know that Charlie's had quite a lot of CBT counselling about coping with the stress of fear of dying, he had lots of problems getting stressed during transport, on public transport, because he often had fits on transport. And he wanted to go home, put the telly on, watch the football, get a nice takeaway delivered, and kind of breathe out and try and relax as much as possible, because stress was such a huge trigger for him. And he just didn't want me around him, stressing him about not having the right stuff. He just wanted to relax at home. So we left him at home that afternoon, and he ordered his takeaway, which arrived at 8:30. Somebody from 111, a so-called comfort caller, phoned him at about 7:30 and apologised for not having got the doctor out to him. So that was that call. And when we found Charlie the next day, because we were very concerned because nobody could get through to him on Sunday morning. When we found him, the takeaway was on the table, uneaten, apart from one piece of food, which was on a fork, which was on the other side of the room. So he'd obviously had the seizure around 8:30 when the food arrived, and taken one mouthful, and that was it. He went, and he died from SUDEP during the course of that seizure. NHS 111 has to change the way it triages people. It's also got to change the way it claims to help people with prescribing. So one of the things that we found out afterwards is that, and this is so important for other people with epilepsy, is that about 20 odd years ago, when we started moving away from having on-call GPs in our local practice for out-of-hours stuff, a law was passed, a piece of legislation was passed to make sure that people who needed emergency medication could access emergency medication at weekends and out-of-hours through a pharmacist without a doctor. Access to Medicines Act is called. And if you're on a repeat medication, as long as it's not a controlled drug like heroin, if you're on any repeat medication apart from controlled drugs, you can go to your pharmacy with some evidence of your repeat status, either on your phone or a copy of a previous prescription or a box of meds. And you can ask the pharmacist to give you an emergency supply to tide you over till the GP opens on the Monday or whatever. And they have to give it to you by law. It's your legal statutory right. And it's why, and it was created because government knew that getting rid of GP on call out of hours was going to cause problems for people who needed urgent meds. That's why it was put onto the statute books. NHS111 do not issue prescriptions. At the inquest, they were asked the following question: am I right in saying that when somebody calls 111 for urgent meds, what you in fact do is send a notice to a pharmacy that's one of two that's on your list of places to send people? And what you say in that note to the pharmacy is this: somebody by the name of, in our case, Charlie Marriage, will be coming into you because he needs an emergency supply of medication. That's it. They don't say what the medication is. They don't check that the pharmacist got it. They don't tell the pharmacist what the condition is or how urgent it is. Absolutely nothing. It's literally like a piece of paper saying, this person is coming in to see you soon. That's it. That's all they do. But they make out that they issue emergency prescriptions, and they don't. They don't even call them that themselves. They call them referrals. It's so misleading. NHS England is deliberately trying to stop people from understanding that that's their right. I mean, I think it beggars belief. And to be quite honest, it's dangerous. It's not just incredibly anti-democratic and authoritarian, it is dangerous. Because actually, if we'd phoned 111 and they'd said, look, you don't need us, we'll just put you through a whole load of hoops you don't need to go through. Phone round, find a chemist that's got Fycompa, go there, take your phone with you so you can show them that you've got, it's on repeat for you, and they can issue it for you under the Access to Medicines Act. They'll give you enough to get you by till Monday. If they'd said that to us, that's exactly what we would have gone and done. And I'm quite sure that by lunchtime, we would have got the medication that Charlie needed. And he would have taken it. And, you know, I'd be outside, I'd be out off somewhere with him this afternoon, not doing this with you.